But we want to begin by showing you in its entirety the entry by our next guest, who will be with us in just a moment from Texas. Whylan Rucker is the first prize high school winner, and the focus on health care in America and the issue of whether or not we can and will have universal health care.
Should health care be universal? Hi, my name is Whylan Rucker, and I'm a senior at Clifton J. Ozane High School. And this has been an ongoing issue for many years. Many people believe that a universal health care system will offer all citizens equal amount of access. Others believe it would deplete our nation's resources and cause services to be slower. Here's how people at Beaumont, Texas view the issue, including the Jefferson County pharmacists. You all right? You never know when it could happen to you. A crisis occurs and you're forced to spend weeks or even months in the hospital. The first question in your mind may be, will I survive this accident? And the second question, will I be able to afford my medical expenses?
The very poor can get something. It's just the people that's in the medium that's actually, they have just enough not to have enough to qualify.
If you come down with anything, flu, diarrhea, headache, fever.
Almost half of Americans say they are worried about not being able to afford health care services.
America has the best quality health care in the world.
Right now, insurance companies spend $50 billion a year trying to figure out how not to cover people.
Basically what my plan does is it has a mandate.
Each presidential candidate has presented his or her own plan to make the healthcare system better. Some say a universal healthcare system like those established in Canada, the United Kingdom, France, and Cuba is what America needs to heal its system.
If everybody gets health insurance, the lines are going to be worse than the welfare lines.
For sure, like you say, it would cause, some chaos and some long lines, some impatience, some hostility, but the bottom line is it's to benefit everyone.
Yes, you'll have a longer lines and everything, but say, for instance, if you didn't even have a line to go to, you would be in worse shape if you couldn't even have the opportunity to even get in a line.
According to the National Coalition on Health Care, Americans spent $2 trillion on medical expenses and hospital costs in 2005. That's over $6,000 per person.
One shot every time she gets her chemo, and that one shot, that one injection is $6,000 to $14,000. I bought cars for less than that, and that's ridiculous.
68% of Americans say outrageous medical expenses have forced them to file for bankruptcy.
Paying for the prescriptions is more important than eating, and I think that's sad.
And to challenge the workforce and challenge all the drug companies that's already marketing things way above the price of what they actually could be.
According to Michael Moore's documentary, Sicko, there's a 500% markup on most prescription drugs. National surveys released say the top reason why people are uninsured is because of the high cost of health insurance.
I think it's a shame because due to the fact that drugs are necessity, and for the drug companies to jack up the prices when the poor people already can't afford it.
My wife is having a difficult time with her chemo and us paying for it. We have just one injection that costs $14,000. We can't pay for that, but we can pay a part of it, and our insurance company can pay a part of it, but the rest of it we're going to have to be in debt for.
Bill Krebs says each injection his wife Marie takes for her chemotherapy treatment pushes the couple further and further into debt. But he is not in favor of establishing a universal health care system.
Universal health care sounds great. It sounds like it would be the answer to a lot of people's problems. But in countries which have utilized universal health care, it's proven not to be very effective because it dilutes the system to where the people who need it the most, the sick people, have to stand in line for long periods of time, sometimes months, to get the care they need. For those who can't afford the best health care, that's when the government should come in and subsidize on top. But there should be a little responsibility from the citizen.
It will be required by law that every man, woman, and child in America have health insurance coverage.
No more discrimination, period.
The bankruptcy of the system, that we have an opportunity to join all these players together and come up with a solution.
Opinions may vary, but the fact still remains the same that millions of people are in need of health care and something needs to be done.
Our first place winner from the StudentCam contest, and joining us now from Houston, Texas, is Whylan Rucker, who is a student at Clifton-Ozen High School in Beaumont, Texas. Thanks very much for being with us, and congratulations.
Thank you.
Let me ask you first, why did you select this topic?
I felt like I could closer relate to healthcare issues because on 9/11, I myself experienced a healthcare issue. My appendix erupted and I had to get surgery. And if my mom and dad weren't to have insurance, they would have to pay that outrageous bill. And I think if I think about all the others who don't have health care and could be in situations like that and who are in situations like that who have to pay that off, and I don't think that's right.
So when you saw this, as C-SPAN was working with Time Warner Cable in your part of Texas, why did you decide to submit this entry and watch our network and talk to people in the Beaumont, Texas area about health care?
Well, first and foremost, it's one of the biggest dilemmas and disputes in the nation today, along with the Iraqi war and the economy issues. And I just felt like it had been a great opportunity to reach out to the community as well as the world.
A couple of questions about you, first and foremost. Your name, Whylan, where does that come from?
I really don't know. My mom wanted something different, and I believe she heard it on a talk show. And a lot of people always say, oh, that reminds me of the country singer Whylan, and she never thought of it like that. I think she just was creating something.
Did you ever ask her? Was it just something that, was it really a talk show, or?
Yeah, I believe it came from a talk show.
And you are a student in high school. What do you enjoy studying the most?
Probably English. I like to write and read.
And any thoughts about college?
Yeah, I'll be attending the University of Texas at Arlington in the fall.
And you will be studying what?
Right now I'll go to the College of Natural Sciences and Liberal Arts, but in the future I'd probably look into studying pre-journalism and business.
And if you would, just for a moment, share with us and our audience a little bit about yourself, your family. You're obviously in Beaumont, Texas. What else can you tell us?
I am a dancer. I've danced for 9 years and more. My mom is a BISD, the Beaumont Independent School District Administrator, and I live with a family of 2 parents and 2 siblings, 2 older brothers who both attend Lamar University. I was naturally born in Natchez, Mississippi in 1990, and that's about it.
What did your family think about this entry, and how did you put it together? Who did you work with?
I worked with my faculty advisor, Camille Briggs, and also another student, Asha Winfield. And Camille Briggs actually worked for the local news station, and she recently transferred to our school to be the video production manager or whatever. And then when I saw this opportunity, I went up to her and asked, could she help? And she jumped right in.
You're a senior at Clifton-Ozen High School. Who is or was Clifton-Ozen?
I don't know.
That's okay. Let me also let our audience know that they can participate. We have phone lines divided 2 different ways. If you're 18 or under, we're asking that you call 202-737-0001. And if you're 18 or over, 202-737-0002. We want to welcome into this discussion Julie Rovner, who is with National Public Radio, health policy correspondent, and a frequent guest here on C-SPAN. Thanks very much for joining us.
Good morning.
What did you see and hear from this entry?
Well, I thought it was very impressive, certainly for a high school student. This is an issue that I've been covering since before this student has been alive, certainly, and it's an issue that the nation's been grappling with, I guess, for about 100 years now, and has not been resolved, as she said at the very end of this video. And certainly it looks like the country's going to take another stab at it with this next president, whoever he or she may be.
Well, let me paraphrase her question, because she's asking, should health care be universal? My question to you is, can it be? Can this country support universal health care?
Well, certainly most other developed countries do. This is certainly the lingering question that the nation keeps debating. If you listen to presidential candidates of both parties, I think certainly there is a desire for everyone to have health insurance, or at least access to health insurance. That is the stated goal from both Democrats and Republicans, that everyone at least have access to health insurance. Whether we get there is another question, and how we get there is certainly the biggest question. And that's certainly what the debate is going on about right now.
Whylan Rucker, do you think we can get to the point where this country would support, with the politics that we've gone through, even going back to when you were just a toddler in the early 90s, when the Clinton administration tried and failed to propose universal health care? Can we get there?
I think if we have a determined president, as determined as the candidates say they are, and willing, I think if we try, it takes some time, but we might be able to accomplish this.
What did you learn as you went through this process of putting it together?
I learned that the nation is spending tons of money on prescriptions, and that the prescription companies are part of the main reason that healthcare is so expensive. I didn't really know that before I did this, and I also learned that it's affecting our country.
Julie Rovner?
Yes, indeed. The nation does spend a lot of money on prescription drugs, although in the last few years, hospital care has actually once again eclipsed prescription drugs as the largest single segment of healthcare spending. So even though prescription drugs are going up still fairly rapidly, they remain not the largest segment of healthcare spending. They're just, I think, the most visible segment of healthcare spending for a lot of people, because drug companies do make such high profits.
As you look at the Democratic race, Senator Clinton, who is proposing a form of universal health care, Senator Obama says the process must begin by making sure that all children have access to quality health care.
This is pretty much the only big difference between the two plans that the Democrats have, and I think that's why we've heard so much about it. Certainly they both want universal coverage, which is different from universal access, which I think is really more what Senator McCain is talking about. And Senator Clinton would have a mandate for everyone. She wants to have universal coverage by having universal coverage. Everybody would be required to have health insurance. This is what they're doing in Massachusetts. It was actually a Republican governor, former presidential candidate Mitt Romney, who signed that into law. And what Senator Clinton is saying is that you can't really get the health care system under control unless everybody has health insurance, and for everybody to have health insurance, you have to require it. Senator Obama is worried about people being required to have health insurance if maybe they can't afford it. Senator Clinton says she's got subsidies that would make it affordable. Senator Obama says that he's a little bit worried about that, but he would at least have children required to have it. So that's the one substantive difference between the two of them, and I think that's why you've heard about it. All the rest of their plan, and their plans are very elaborate, but they basically sprang from the same source, and so the rest of their plans are basically the same. And that's why you're not hearing so much about the rest of their plan, which takes up pages and pages and pages.
We're going to get to your calls in just a moment. Some background on C-SPAN's StudentCam contest, an annual project here at this network. We had just over 300 entries, 313 in total, and out of that, 8 focused on religion. In fact, the grand prize winner was religion and politics, and we'll introduce you to those 2 recipients on Sunday. 23 focusing on health care, and only 1 dealing with Cuba. You can watch the winning entries at StudentCam.org, and our thanks to our cable partners, including Time Warner in the Beaumont, Texas area, where Whylan Rucker is joining us, a high school student, a senior, going on to college in the fall. And now onto your phone calls. Princeton, New Jersey, good morning.
Hi, Steve. I have too much to say, so obviously you're going to have to cut me off. Just give me a little bit of warning, and I'll wrap it up.
Okay.
Okay. The first, since I don't have enough time, I want to give you a place to go to get the facts, which are usually hidden around in this thing. There's an organization of doctors called Physicians for a National Health Plan. Then they have a site called www.pnhp.org. And they have all the facts. Okay. I want to just talk about efficiency of our health plan, how efficient it is. The basic fact is that other wealthy countries get better health care than we get, as measured by all the public health statistics, life expectancy, infant mortality, baby weight, all that stuff. And they do it at a cost of less than half per person than we spend. They're simply much more efficient. Let me give you an example of what we could do if we had an efficient system. We could give Medicare to every person, a super Medicare with no copays, no limitations, no deductions, complete drug coverage, and it wouldn't cost any more than we're now spending. Now, how can that be? It's because of the incredible waste in our system. We waste between 100 to 200 billion a year because private insurance companies have overhead rates of 15%. They waste 15% of their money. The Canadian system has an overhead rate of 1.3%. But it's worse than that because the private insurance companies require doctors to fill out long forms. A private insurance company is in business to make money for its stockholders, not to give good medical care or to be efficient. And if they can save a buck by having a doctor fill out a 40-page form, they will do it. We spend too much money trying to deny people health care.
Caller, what's your background?
I'm a mathematician.
Okay.
I'm not a doctor, but I support these doctors because they have the facts and the figures. And as a mathematician, I believe in looking at the facts and the figures, not just making vague statements about our current health care.
Okay.
Okay.
Thank you. Did you have a question?
Did I have a question? Yes.
Okay.
The main difficulty, there are no technical difficulties. We can look at other countries and see how we can have many different single-payer healthcare systems that would be efficient and insure everybody for everything. The problem is that our political leaders do not have the political courage to support a single-payer healthcare system as they did support Social Security and Medicare.
I'm going to stop you on that point because it's an important issue. Is the politics different in 2008?
Yes and no. Certainly, health care is a big issue in this election. I think it's been a little bit eclipsed in the last couple of months by the economy, as we've seen in some of the polls, although pollsters will tell you that health care costs are a piece of voters' economic worries. So when you see the economy moving to the top of these public opinion polls, that doesn't necessarily mean that health care is being pushed down. It's a piece of that. Food prices, gas prices, health care costs are really part of that. Whether or not health care is the first issue to be addressed with the new president and the new Congress next year still remains to be seen. But certainly I think it's clear that the nation is gearing up for another try at this. As to the caller's discussion about a single-payer plan like Canada's, this has been a continuing sort of undercurrent for years. There has always been a significant minority of the American public, and by significant I mean, you know, up to a quarter, even up to a third, if you go out and talk to people who want to have a single-payer plan like they have in Canada. It would be Medicare for all, who really very strongly support this. The problem is it's not getting up towards a majority. It's a big chunk of people, but it's not more than half yet. There are problems that have been pointed out in places that have these single-payer government-run plans, as Whylan pointed out in her video, that there are waiting lines, that the government then controls the price of things, and that may limit innovation and the development of new types of drugs or new types of procedures, that you may end up limiting the availability of things. Then there's a concern. People want things, but they don't necessarily trust the government. You worry about the free market. Certainly Senator McCain, whose plan we haven't talked about, is much more free market oriented than the plan put forward by Senator Clinton or Senator Obama. So there's a big resistance to having the government run the healthcare system on the one hand, and there's big support for having the insurance companies maybe not turning a profit on health care on the other, and that's been the sort of butting heads that we've had for these last 50 years as the nation has tried to struggle with this issue.
Our guest is Julie Rovner, who is a graduate of the University of Michigan, Ann Arbor. She has written a number of books, including Healthcare Politics and Policy from A to Z. She previously worked for Congressional Quarterly, now with NPR, and Whylan Rucker, who is an 18-year-old high school senior in Beaumont, Texas, and C-SPAN's first prize winner in the high school category in our StudentCam contest. Her focus on universal health care. And Topeka, Kansas is our next caller. As we listen to this caller, we'll share with you some of Senator McCain's thoughts about health care as outlined on his website at johnmccain.com. Go ahead, caller. Topeka, you're on the air.
Yes. Whylan, I'm wondering, you presented several scenarios of people talking about waiting lines in other countries, and yet which does happen, but it's generally a myth, that the care is bad in other countries, and you presented very little to the positive side. Why did you make that choice?
Thanks for the call. Whylan Rucker, did you want to respond?
Oh, yes. I don't think I was too busy presenting the negative side. I was just stating what's going to happen and what's likely to happen. Yes, there are positive sides, but as well, the biggest issue with the universal health care would be the lines and the resources depleting.
By the way, if you're under the age of 18, you can give us a call. The number is 202-737-0001. Lancaster, California is next. Good morning.
Good morning. Congratulations, Mrs. Rucker. I just want to know, what candidate do you think would have the best health care for you? And as a black woman, what do you think that this country would be in, 20 years? And this is going to be a multi-country, and you're going to be able to, as a black woman, interact with different races. And I see in these young people today that I'm so proud that they don't have that old way that we were brought up as being together with other different races and communicating and loving one another. And I'm so proud of you guys, and I hope you guys, I know you'll do a better job in this current administration. Thank you.
Thanks for the call from California.
Thank you. I actually think universal health care would be better for me and for everybody else in the country for future purposes. I like Senator Obama's plan to not mandate it, because then those who have the extra money laying around, that's a waste of money going to those who actually would need it. So I don't think it should be mandated. I think it should be offered and extended to everybody.
Will you vote in November?
Yes, I will vote.
Have you thought, for you personally, what that experience will be like?
Sir?
Have you thought about what the experience will be like as you go into the voting booth and cast that ballot?
I haven't thought about it, but I'm almost sure. My mom is a faithful voter every year in both primary and the caucuses.
We'll go to Tampa, Florida next. Good morning.
Good morning. Congratulations, Whylan. I called about 3 months ago on this topic and talked to a woman and asked her if there was a single-payer system, would that eliminate legal liability for business? And she said yes. And I asked if it would also eliminate businesses' need to negotiate contracts with healthcare and or prescription providers. And she said yes. So something like this that would benefit business, isn't it interesting why business isn't lobbying for a single-payer system? And I'll hang up and listen. Thanks.
Thank you for the call. Julie Rovner?
Well, business tends to be run by people who don't tend to trust the government. It goes back to the individual beliefs of people. But in fact, as the earlier caller mentioned, there are more and more doctors who are actually getting frustrated with dealing with insurance companies and are moving more towards they're dealing with the government on Medicare, which sometimes gets them frustrated, but there are more and more doctors who are saying, oh, well, at least we can deal with Medicare. Maybe we should just deal with the government, not deal with the government and the insurance companies. But business is not coming around towards towards supporting single payer yet, at least not as far as I've seen.
And again, let me direct you to StudentCam.org. It's also linked through cspan.org, where you can see our winning entries and our partnership with our cable companies, including Time Warner in Texas. Our thanks to them as well. Sun City Center, Florida, good morning.
Good morning. Thank you very much for taking my call. I have been wanting to express this opinion for so long, so I hope you give me a minute.
Certainly.
The market can still be free, even if you're paying your premiums through a government agency instead. The insurance industry is the one industry that gambles they will give you nothing for your money. And they try as hard as they can to do that. Now, I was self-insured at work at one time. And I see no reason why the American people can't choose to be a self-insured group. The biggest group is the best group. And the propaganda about socialized medicine is what's stopping this from happening. I'm a libertarian, by the way. I believe in freedom of choice, though. And I think we're getting ripped off by the insurance companies with their CEO salaries and their sales expenses and advertising and whatnot. I see no reason why the people can't choose to pay their premiums through a government agency and get the same kind of care that they would get. I'm on Medicare. So I'm not even affected by this, but I believe very strongly in it. I would not go on an HMO again if you paid me. I was on one once, and I hated it. They try to regulate everything. They try to tell your doctors and hospitals what they can and can't do. Medicare does not do that.
Well, that's actually exactly what Senator Clinton and Senator Obama are proposing. They are not proposing a single-payer plan. They are proposing a plan, a series of. They would more regulate the private market. They would also offer an option of a government-sponsored plan, much like Medicare, that anyone could join if they didn't want to be in a private plan, and then let the market compete. That's precisely the plan that they would be offering.
St. Petersburg, Florida, you're next. Good morning.
Yes. I want to know if they knew that the congressmen got together and they voted on the Medicare withdrawals, and they've taken like $10 billion out of Medicare, and they're taking more to privatize the insurance companies here in Florida. Like they're paying for free dinners to get there, and blah, blah, blah. And that, like my medicine went from $40 to $306.
I think the caller is talking about the 2003 Medicare drug law, and as part of that law, there was an effort to encourage more private plans to join, to offer coverage to Medicare beneficiaries, and there was indeed extra money for those private plans, a lot of extra money. Actually, it's about $150 billion over the next, I think it's 5 years. And there's an effort by the Democrats in Congress to kind of tap into that money and reduce some of that extra spending. They wanted to use some of it to pay for the expansion of the state children's health insurance program last year. Now they'd like to use some of it to help pay. There's a deficit, a problem with paying physicians under Medicare. And Congress is going to have to work on that legislation before the end of June. In fact, it's going to be coming up in the next couple of weeks. And so far, President Bush and the Republicans in Congress have not wanted to tap into that money. They want to keep those private plans profitable and offering that coverage to those Medicare beneficiaries. And they've just said no, and there's a continuing fight over this, and we're going to see how this is going to resolve itself really in the next couple of weeks, because they have to resolve this issue by June 30th. Otherwise, physicians under Medicare will see their pay cut by 10%, which nobody, neither Democrats nor Republicans, nor certainly the doctors who take Medicare, want to see happen.
Julie Rovner is here in our Washington, D.C. studios. She's healthcare correspondent for National Public Radio. And Whylan Rucker is a student in Beaumont, Texas, and she is joining us from Houston. I want to ask you one question about part of the video. You're in what appears to be a healthcare clinic. How easy or difficult was it to have access to this facility?
I was never in a healthcare clinic itself. That was actually footage taken and put together, edited and cropped to make it seem like I was there. I wasn't actually there, though. It was just to get the overall effect.
So in order to put this entire project together, what other elements did you use? How much did you shoot yourself? How much did you take from C-SPAN, and where else did you research material for this final entry?
It took time and time. I stood in front of Christian St. Elizabeth, a local hospital, for hours trying to get the entrance and the outrance that you see in the video, reciting it over and over again to get it perfect. The interviews took just a complete afternoon from about 3 to 5 p.m., and then the editing. The editing itself took one whole day, from 9 a.m. to 9 p.m., and then at the end the project was finished.
Well, we want to congratulate you, and we have time for some more calls. Tempe, Arizona, good morning.
Hi, my name's Sean. I'm from Tempe. I just recently got out of the Navy, and I'm now eligible for the VA if I need it. But my history being, I'm also the son of a Vietnam vet, and his friends have all had great nightmares with the VA. And the thing that makes me want to be successful more than anything is the fear of someday having to use the VA. And I'll gladly pay for health insurance, and that's what I do. Right now, I'm an individual investor / student here in Tempe. I pay about $1,500 a year for it, and the way I look at it is, if I pay $1,500 a year over a 10-year period, that's $15 grand, if I have one major medical issue once every 10 years, that's going to eat up 20 or 30 grand, and that justifies that cost.
Thank you. Julie Rovner.
Well, actually, the VA healthcare system has improved tremendously over the last 10 years. Although it's interesting, the VA is the classic single-payer healthcare system, and it has some of the advantages and disadvantages of a single-payer system in that sometimes the government has not provided it with enough money to serve all of the people who are eligible. On the other hand, the VA has had the ability to do things that the rest of the healthcare system has not been able to do. For instance, it has a model electronic health record where you can go into any VA facility anywhere in the country and they can call up not just all of your records but all of the x-rays or scans or blood tests, any kind of lab tests that have been done anywhere. It's really sort of an amazing system that's sort of looked at as a model for everyone else. And also a lot of impressive things have been developed by VA medical researchers. So the VA, on the one hand is sort of the epitome of good medicine, but as you pointed out, there are people who have had trouble with waiting lines and with not being able to get good care at VA facilities. But I would suggest that before you sort of write off the VA, you might want to see what kind of care is available.
This viewer from Sioux outside of Omaha, Nebraska wonders why prior to Medicare, most hospitals were nonprofit, including the Methodist Hospital in Omaha, and then goes on to say, why did the hospitals become profit centers following Medicare? My opinion is a guaranteed government check for covering rooms.
That's an interesting question. There are indeed, and I think most hospitals are still nonprofit. I think the for-profit hospitals, there are a number of for-profit hospital chains. I don't know that it was Medicare per se. I think it was actually health insurance in general. I'm not sure of the timing of when the for-profit hospital movement, I think, happened a little bit after Medicare started. It's the same with health insurance, by the way. Not all health insurance is for-profit, although the callers earlier were right. I mean, there is a significant portion of the health insurance industry that is for-profit, as there is a portion of the hospital industry that is for-profit. But not all of them are, and there are certainly large swaths of both the hospital and health insurance industry that is not for-profit still.
Houston, Texas, good morning to you. Welcome to the program.
Yes, hi, how are you?
We're fine, good morning. Thanks for calling in.
Yes, I'm calling. I want to put a little different spin on things. I'm disabled and have been since 2001. I had very good coverage, health insurance coverage, from my company, and also another policy I bought when I was very young and continued paying premiums. I was one of these people that had enough coverage. Of course, my family and friends did not have the coverage. But when I became disabled, after a period of time, I was put on Medicare. Even though I had my good insurance, I was not able to use it. And there was something I was taking up that maybe somebody else could use. And my problem is everybody needs health care because if you look at long-term medical conditions, a lot of it could be prevented with preventative care medicine.
What's your disability, caller?
I've had 7 spine surgeries and lost my right lung. So various things, but it caused me to become disabled.
And how old are you, if I may ask?
I'm 53.
Thanks for the call. Julie Rovner.
Well, certainly, Medicare is available to people who are on Social Security disability. It's not if you're disabled but not eligible for Social Security disability, you get on Medicaid. But certainly that's considered a good thing for a lot of people who are disabled because often if you have insurance from your work and you become disabled, you don't have that. So the caller is actually lucky that he was able to have insurance and then get Medicare. A lot of people are in that situation where they're not able to get any kind of insurance, and it's actually a fairly long, lengthy waiting period. It's 2 years before you can get Medicare once you become disabled. So that's considered an important safety net.
Whylan Rucker, do you know families and friends that don't have insurance?
I do, and they suffer tremendously.
Can you share with our audience what your own experiences have been like?
A lot of my family have to refer to my parents for help and for assistance, and just other family all around trying to get assistance. My one family member was on life support and couldn't get it paid for, so it was either take your life or pay it, and once you can't pay it, you have to take that risk of pulling the plug or not. And she was successful in the end, but what if she hadn't been, you know? I don't think it was her fault that she didn't have the money.
We'll go to Boston next. Good morning.
Morning. In Massachusetts, we have this new health care plan where it's a mandated plan similar to Obama's and Clinton's. And as a process of just keeping the insurance pool only in Massachusetts, it's not really cost effective. To have a nationalized plan would increase the insurance pool so everybody who has enough wealth to compensate for those who don't have wealth is the only way that one of those sorts of systems can work.
Thanks for the call. Julie Rovner, is the Massachusetts plan a model for the rest of the country?
Well, that's certainly a big debate right now. There are people who say it is and people who say it isn't. One of the problems with the Massachusetts plan is that it is underfunded. They're providing more subsidies than they actually have the money to do, and that's going to come to a head, I think, in the next couple of years, and they know that they're going to have a problem with the funding. But certainly there are several 100,000 people in Massachusetts who now have insurance who didn't. So I think by any measure that's probably a success. Whether it will continue is, you know, how well it will continue and what will happen when that funding crunch hits is yet to be seen. But everybody's certainly watching it with an awful lot of interest.
Next call, Portland, Oregon. Good morning. Welcome to the program.
Good morning. I was just going through the channels there. Realistically, is there going to be health care? I mean, you know, I don't recall McCain really offering too much. Of course, the two other candidates offer quite a bit. Now, in Oregon, we have the Oregon Health Plan, and I don't even know where that's at.
I'll stop you on that point. Whylan Rucker, what do you think? Will there be some sort of national health care, universal health care policy as a result of this election in the next couple of years?
As I stated before, it depends on the candidates and whoever is elected. It depends on their determination and how willing they are to actually put the plan in effect. If they want it, they have to go about the process to get the nation to agree to it, and as well as the government. Everybody has to participate equally, including the candidate themselves. They have to be determined.
Do you think Congress is in the mood to support this?
They have a lot of work ahead of them, so I couldn't speak for them, but they probably wouldn't be.
Julie Rovner?
It depends what the Congress looks like, certainly. This is always a tough issue for Congress. It's not like, you know, when they did the economic stimulus bill earlier this year and everybody was so impressed that, you know, wow, we have a bipartisan bill. Well, it was a bipartisan bill to basically give money away. Really not that hard. Not a lot of trade-offs there. Healthcare is always going to be trade-offs. You're going to be, you know, this is basically 16% of the nation's economy. You're going to be taking money away from somebody and giving money to somebody else. So it's always going to be a difficult issue. On the other hand, you've got 47 million people who don't have insurance. That's always going to be a big issue, too. And I think if the public really clamors for it, at some point they're going to have to do it.
Whylan Rucker, we want to congratulate you, a senior at Clifton Ozen High School in Beaumont, Texas. And one of the questions we asked earlier, who was Clifton Ozen? The beauty of this program is that we get a lot of emails, and Howard and Flagstaff said Clifton Ozen was a legendary coach of athletics in the Beaumont area, so they named the high school after him.
Interesting.
Whylan Rucker, we thank you for joining us. Thanks for being part of this nationwide contest of students around the country, the StudentCam contest, and your entry on universal health care. Good luck to you.